Hi, everyone. Welcome to this episode of Science Speaks, an interview series from Sciencera that discusses a variety of topics about science and life in the world of science. Today, we have with us Dr. Nicole Putnam PhD. We'll be discussing with her some questions many of us have encountered about the COVID-19 pandemic. She is a scientist who has studied infectious disease pathogenesis and immunity at the Johns Hopkins School of Public Health and also Vanderbilt University Medical Center, focusing on measles virus and also invasive staphylococcal infections. As you can see, she has, and she is currently a clinical microbiology fellow at the National Institutes of Health, so has a good deal of public health and microbiology and immunology background. So her professional interests lie in clinical diagnostics and research, education and training of scientists and clinicians, and she's also passionate about public health and science communication. Before we start, in the spirit of full disclosure, we wanted to convey that the insights and answers provided by Dr. Putnam today reflect her personal views and not of her employer, NIH, or Sciencera. Welcome.
Thank you.
Putnam, thank you so much for taking the time to chat with us. Really appreciate it.
Happy to.
Yeah. Before we dive into some of these burning questions that we have, I was wondering if you would share with the folks what clinical microbiologists do.
Yeah, that's a good question. So clinical microbiology is a really interesting area. If you think about when you go to the hospital or somebody is an inpatient and your physician suspects that you have an infection, they will get a specimen and send it to a lab and you will get an answer back. The clinical microbiology lab is where that specimen goes and is processed and worked up to find that answer. So we basically just find the microbes by various different methods and then can help figure out what treatments might work and communicate that to the physicians.
You're like these little medical detectives.
Yes.
Perfect. Thank you for giving that background. So if you don't mind, we can jump into some of these questions. So I guess maybe start with one of the hot topics or controversial ones that we have encountered this week, or what's flavor of this week in COVID. As I'm sure you're aware, there has been a sort of resurgence or a second wind at the advocacy or from a number of groups who have been asking for hydroxychloroquine to be added as a treatment. And as far as I'm aware, this is something that the FDA had previously given emergency authorization for, but then given the overwhelming number of randomized clinical trials that showed evidence that hydroxychloroquine may not confer benefit and if anything, may even cause harm in certain patients, they suspended that authorization. Has any new respected or established clinical trial data come into light this week that there is again a sudden demand or a sudden increased enthusiasm, if you will, for vaccine again?
I haven't seen anything this week that would cause a resurgence in claims. a couple of things that are important that you said to touch on there are randomized controlled trials. So that is something that they did do or started doing once there was all of this media hype around having something that could potentially work.
Right.
Generally, a randomized control trial is the best way to get the answer. Is this drug going to help, and do the benefits outweigh the risks that might be associated with taking that drug? So a lot of evidence that came out early was really anecdotal reports. So not controlled, not really scientifically approached, but as far as I know, all of the randomized controlled trials have shown that there really is no benefit, and if anything, there may be more harm.
I see. Thank you. Yeah, I really appreciate it, taking the time to talk through that, and also giving a little bit of overview as to why randomized controlled trials are important and, carries more weight than anecdotal studies or case reports.
Yeah.
Really appreciate that. I guess the other thing we have, frequently been hearing a lot of information on is regarding masks, right?
Yes.
Initially, there was a guidance about whether or not to wear masks, and then it changed. And so what evidence do we currently have on masks reducing COVID-19 transmission? Also, I have come across some folks saying cloth masks don't offer any protection, so why wear them? Or the other thing I've heard is, if your mask works, then why do I need to wear mine as well? So, I'm wondering, what can we say to address that, and also, if you don't mind, maybe touching upon, what about face shields, with masks, or maybe without masks, since that's also something that's getting popular these days.
Yeah, that's a lot of questions. So I'm going to try to break them down. Remind me if I miss any. I would say, I guess just to give some context into this, all of the guidelines and public health recommendations are going to come from scientists. And in general, we don't like to say things that we don't have data from. So early on in the pandemic, there was a lot of, there's no data to support that masks can help. And now we've done studies. There are several peer-reviewed publications that show that they do help. And that is one reason why there's been a lot of change in the guidelines as time moves on, is because we're still doing the studies to learn what is helpful. So one thing that I actually wanted to show, I feel like this is a really good display of information. So this is another clinical microbiologist on Twitter, and he took a few different pictures on bacterial growth plates, and from sneezing, singing, talking, and coughing, either with a mask or without a mask. And you can see that significantly more bacteria can grow on the plates if you don't have a mask. And I mean, that's not super surprising, because we have oral flora in our respiratory tract,
right,
and really a visualization of something else, but is a proxy of the respiratory droplets that are released during these common activities. So what I like to think of masks are as a barrier. Any barrier is going to prevent the spread of droplets from one person to another, including cloth masks. And I think one of your other questions was, what can you say to other individuals? That's something that I find is a touchy topic these days. Just there's a lot happening in the world, and people,
right. Absolutely.
Yeah, so I would say that my biggest piece of advice is just generalize, don't personalize. If they feel like you're attacking them for whatever reason, people aren't going to listen to whatever it is you have to say.
Yeah, they also become defensive very quickly in that case.
Exactly.
If we just tell people, hey, you are doing it wrong.
Yes.
Yeah, that's Yeah. So you're saying, say probably, there has been evidence, or I think this picture, like,
I think facts sometimes can turn people off as well. So one way that I have used in the past that makes it a little bit more approachable, instead of just yelling facts at people, is to kind of bring it up like a question or like an interesting fact. Like, did you know that people who don't show symptoms, be it because they're asymptomatic or pre-symptomatic, can still test positive for SARS-CoV-2? That means that anyone that isn't showing symptoms could still be spreading it. And they have no idea. They could feel fine. And that's what makes this more dangerous
than, say, the diseases that have more severe manifestations, like the previous SARS epidemic or the MERS or things like that. It
would be really nice if you tested positive when you had symptoms, and when they went away,
right, then you can at least contain that accordingly, as okay, these people are showing symptoms, so if I'm showing symptoms, I can quarantine myself. But in the other case, I might be infected already and still walking around, and potentially, can infect others.
Yeah, and I don't know the exact numbers, but it seems like a pretty high proportion can be asymptomatic. So that could be a serious factor leading to spread.
Absolutely. Yeah. And I guess that sort of emphasizes why it's not just people with disease, but or showing outright symptoms, but also everyone essentially wearing masks would be useful. And that picture, like like the saying, one picture is worth 1,000 words. I thought that was very telling, because you're really seeing, okay, these are the different activities, and then that first it looks like it also shows there are certain activities, coughing is obvious, but other things that we do, like singing, for instance, looks like generates a lot more droplets, or a lot more, grow up in that Petri plate, as we have seen. And so in closed settings, say choirs or things like that, that might be why it potentially shows why it's risky. It looks like, and the other thing, I guess, the of course, the difference with wearing a mask, like you said, it's barrier. That's very telling. So thank you for that. And so you said the masks, sort of prevent those large droplets from getting into the air, and thus infecting others, and so it can really help. So recently there has also been a focus on aerosol transmission of COVID-19, and so in that case, does this change any public health recommendations we have? And I guess if it's transmitted via aerosols, can I live in an apartment complex, so is it can I get it via air conditioning unit installed in the complex?
That's a good question. So I haven't seen a ton of studies looking at aerosolization and how that can lead to spread. So this might seem like a nuanced point, and it kind of is, but there are some pathogens that cause infections that are spread via droplet. So that's something like SARS-CoV-2. And then there are other things that are spread via aerosols. So depending on infection control practices in a hospital, you will have different levels of precautions set up for rooms. So in droplet precautions, masks seem to work fine, but aerosols can be transmitted. They're much smaller, so you need to have increased protection. So that would mean fit tested respirators so that there's not gaps around your face, negative pressure rooms, like you said, so it can't get into a system or a building in other areas. As far as I know, I think that respiratory precautions seem to be covering our bases right now.
Right.
Another thing that I just thought of actually is to go back to your previous question, thinking about how people are dealing in hospitals. You asked about face shields. That is another thing that I haven't typically seen in a lot of respiratory cases, but it's becoming more commonplace. And I think for healthcare workers or for other people who are at risk of, who can't socially distance, are going to be close to somebody who is potentially infected and could be coughed or sneezed on. It is important to have a barrier like that because it's plastic. A virus and a droplet can't go through that.
Right.
Wearing the mask underneath is still important because droplets and aerosols, they can hang out in the air for prolonged periods of time. So it's not just a physical barrier.
So you talked about people who show symptoms, and also then there are people who are asymptomatic altogether, or there are people who haven't started showing symptoms even though they might be infected for a number of days. Then they started showing symptoms at a later stage. So my question is, why do people respond differently to COVID infection? Some people, not developing serious symptoms versus some others who are, we hear these cases of individuals who are seemingly healthy and young and still suddenly have critical or even fatal complications.
Yeah, that's a good question. That is, and probably will be an extremely complicated answer for us to work out. I think that we know a few things. So there are a few factors that are associated with worse outcomes, more severe disease or death. Those things are age and gender. Like you said, young, healthy individuals may have better outcomes, but everyone kind of responds differently. So you don't know how it's going to turn out, which is kind of scary, but also these are things that we can study. So there are lots of things that are different between a man and a woman. That is not the factor that's leading to differences. So there must be other things that are associated, and we still need to tease those apart. But in general, I think it's going to come down to maybe the route of transmission, where that's one theory that I've heard is infectious dose, where you in an indoor environment.
How much virus you are exposed to. Okay.
Yeah, so if you were indoors with somebody who was infected for a long period of time, you guys were really close, versus maybe you got onto an elevator after somebody got off that was infected, and it was like a really quick interaction. So that's one theory, is that how much virus you take in could cause differences. Also, though, it just has to do with your overall state of health. So if you have underlying health conditions, those will likely be exacerbated with COVID-19 infection, but also vice versa. So if you have underlying conditions,
the complications due to COVID could be exacerbated as well. Okay.
Yes.
That does make sense. And I'm sure even people who look healthy and are young potentially might have invisible underlying conditions as well. And
yeah, that's true. So, I mean, somebody can be healthy but have an undiagnosed condition, and you might not know about it until something like this happens.
Right, and I think like even though we're there are studies underway to tease the differences apart and whatnot, that this probably gives reason that anybody could be affected by it, and so potentially try to take the precautions what we can.
Yeah.
Okay. That. Thank you. Yeah. That really helps. So the other thing I've heard, in the UK, for instance, people were or the government was talking about issuing people COVID passports. It's basically, like somebody got an infection and then they recovered. So now they, like the theory that they're okay. And so then they can go back to work or, so my question is, like, are people who get infected and recover, are they immune to future infections? And is it okay for them or, people to not take further precautions against getting infected again? Because, from what I understand, like, for example, chickenpox, like I got a vaccine a while ago, and the understanding is you don't need one probably for your life versus flu. Like I probably got the flu, like a couple of years ago, but there's no guarantee that I'm not going to get it again. And from what data I have seen of COVID, the people who have had a confirmed case and recovered, only a fraction of them had antibodies. So what do we gather from this? Like are people okay after an infection? Can they be infected again?
Yeah, those are all very interesting questions. It can be kind of complicated, so I'll try to break down some different points that you said there. I think that it is too early to say that antibodies are definitely a correlate of protection. That is a guiding principle in immunology that we would love for to be able to follow here. That's just kind of the basis of how we measure vaccines oftentimes is, are antibodies produced? And then you can do other tests to see if they're neutralizing or if they can prevent further infection. But not every infection is going to lead to a lasting memory response. Or like you said, the flu. So there's a couple different things at play there. So some things like the common cold you can get every year. Mm-hmm. And I guess similar with flu, because their antigens can change so quickly.
Right.
Different proteins that we've made antibodies aren't effective anymore. Another thing, however, is just not making an immune response that stays around. So that's common in some infections where, for whatever reason, there's not a memory response that lasts, in which case you may make antibodies for a short period of time, but those will wane over time, in which case you would then be susceptible again if those were protective. I don't think we know enough yet.
Right.
And I've seen a couple of different anecdotal or case study type reports that kind of go both ways. I don't know. So there are some people who have virus that sticks around for a long time. So they can test positive repeatedly over months, but then maybe they have a couple negative tests.
Negatives in between. And so it kind of looks like you had a recurring or a new infection, but
and then there's case studies where people are reporting 2 distinct periods of them having symptoms and positive tests at both times. So maybe they didn't make antibodies and they truly did get 2 infections. Maybe this is a case of prolonged viral shedding and they just have cold symptoms. I don't know. It's extremely complicated.
I understand. And I guess, adding another layer to that, there's also, like you said, the memory response may not always be it's not solely driven by antibodies either, right? So you have and so there is a lot to unpack there. And so I guess we don't have enough data yet to say one way or the other to conclusively say, okay, so what I'm hearing is, people may or may not get another infection. We don't know. And probably can't conclusively be confident, okay, I got COVID now and I'm good.
Yeah. I guess there's a couple other interesting point. So we think about coronaviruses, or at least in the news, it seems like they're all bad, but they infect humans, all types of animals, and it's not necessarily something that always is associated with symptoms. This coronavirus is particularly scary in my opinion, but there are 4 normally circulating coronaviruses that have seasonal effects and cause common cold-like symptoms. So that's something that you can get repeatedly infected with, and you're not going to maybe mount an immune response. The symptoms and outcomes are going to be way less drastic though. So that's one thing to consider. But then on the other end, just not every pathogen we can make an immune response for. If we could, we would have vaccines against all of these things.
All of them.
All of the common things causing infections, we would be able to prevent before they even happen. So clearly there's a lot that we still haven't figured out yet.
So I'm glad you brought up vaccines and our immune responses. So I was wondering if you could talk a bit about the leading vaccine candidates that are currently in trial. So I've heard of the candidate from the company Moderna, and then another one from trials run by Oxford University, I think, that have shown promising results. So I was hoping you can,
Yeah, I'm glad you said leading candidates, because those are really about the only ones I know more about. There's a lot that are going through the pipeline right now. It's better to have more options just because it can be a long process. So both of those, so there's the Pfizer, which obviously is a large pharmaceutical company at Oxford that have partnered, and then Moderna, which is based out of Cambridge, which is partnering with National Institutes of Allergy and Infectious Disease. So both vaccine candidates are mRNA vaccines. They're both going into phase 3 clinical trials, which means they've gone through phase 1, which is basically just safety. So they are going to test different doses, look at if you're able to mount an immune response, and measure toxicity and adverse effects to make sure that they can give a safe dose. In phase 2, they'll expand the number of people that they test and also the populations, but still focusing on healthy individuals. And phase 3 is, much more expansive. I know Pfizer is looking globally. They are a huge entity, so they already have a lot of resources and collaborations, which is one thing that I think probably helped them in this situation. But in this case, they will open it up to individuals who have natural disease, just to make sure that it's not going to have adverse effects in people who are not otherwise healthy. So I think that in these trials, there's 30,000 individuals that are going to be enrolled. That's per FDA guidelines. And I don't know much about the clinical trial design for the analysis. That's something that's important for clinical trial researchers to develop and have written down before they actually get any of the data, just to avoid any bias, whether they know that they're doing it or not. They'll already have the plan of how they'll analyze it.
You're picking the wrong population or looking at the wrong people, that can lead to a lot of problems.
Yeah, and so both of these studies are going to test the experimental vaccine versus placebo. I think both of them get 2 doses, and then they'll just look at immune response, toxicity, adverse events in this larger population to see if it's effective to move into humans. I think they both target the spike protein. I could be wrong about that. I don't know that for sure, but that would interrupt the virus from infecting the cells. So if you can stop it.
Spike protein is the outside, sort of the outside protein of the virus that it uses to bind or like get into our cells, right? Is that?
Yeah, I saw that Pfizer actually said it was the receptor binding domain. They like have, that's what the antibody is specific for, or if that's what they're hoping the antibody would be specific.
So you would potentially try to block the virus from getting into the cells and thus causing disease. And I guess you brought up a very important point about, the testing it in like a larger population, and especially given the variability of or the degree of disease that we have seen, and how much it varies from individual to individual and across, like even across countries. So perhaps, having resources or connections in various countries and institutions to run these trials and get data not just from like one group of individuals or one country, but multiple areas probably would also help. Is that right?
Definitely.
Okay, so you gave us a lot of really great information today that has been very helpful. So I'm wondering, what are your go-to places or resources to get accurate and reliable info about the novel coronavirus and COVID? Because I know there are all these websites and videos, and if you just Google them, these are the things that show up a lot of times on the top, and many of them are not accurate and quite even misinformation or disinformation. So where do you go to find accurate and reliable information?
Yeah, there truly are just so many resources out there. I would say that for like general questions or maybe guidance on public health guidelines, that kind of thing,
Mm-hmm.
the CDC is very helpful.
The CDC?
The National Institutes of Health can be very helpful,
Mm-hmm.
and Mayo Clinic. They all have phenomenal websites. They're updated regularly, which is helpful. And then I would say for data purposes, there's a couple websites that I look at regularly. So Johns Hopkins, it's the JHU COVID-19 global map or something like that.
Yes.
And then there's another one from a website called 1.3 Acres. It's coronavirus.1.3acres.com.
Oh, I was not aware of that.
Yeah, the numbers are the numbers and the words are spelled out. So maybe I can send you the link, but they have a phenomenal repository of data. So, and they show you all of the different ways it can be visualized, which I think is incredibly helpful. So they have cases, tests per population. You can look at each state. You can look at globally different countries. It's just, it's really interactive and user-friendly too.
That's fantastic. And so you said for, say, somebody who is just interested in looking up useful information.
If you're a data nerd. One other source that I use and could recommend would be the New York Times coronavirus briefings. So
Okay.
New York Times is generally something you have to pay for a subscription, or you can only see so many free articles a month.
Right.
But they are making all of their coronavirus articles accessible for free without a limit.
Oh, that's great.
Yeah, you can put in your email address and they'll actually come right to your email. So that's something that I find helpful too, because then I don't have to go searching through the news. It can come to me.
That's great. So another question I had was, schools are slated to open in the U.S. in a few weeks. So I'm curious as to what kind of data we have, or how does COVID affect kids?
Yeah, that is also a little bit complicated, like most things, coronavirus related. So in general, this is like a blanket statement. I have heard that kids are generally going to exhibit more mild symptoms. So they may still have a fever, cough, maybe vomiting or diarrhea. I've also heard there's difference in maybe the ability to transmit. So if you're younger, you might be less able to transmit, but then kids over 10 have the same rate of transmission as adults.
Oh, I think yes. Oh, sorry. Go ahead, please.
There's one big caveat with children is there is a rare consequence, but it's called multi-site inflammatory syndrome in children. The abbreviation is MISC. And this is basically just generalized inflammation. I think it's localized to endothelial cells, so the cells that line your blood vessels. But that can affect various parts of the body, your heart, your brain, organs, skin, and that can have really severe side effects.
I see.
So it's not all generally mild symptoms. There can be some pretty bad outcomes still.
And I guess it's very interesting that you mentioned the transmission rates are different, but it's not necessarily across all like school children, right? So you said under 10 it's lower, which I guess like it's probably important because we when we're opening schools and things like that, it's usually it is it's great if children are exhibiting milder symptoms in general of sorts, so to speak. But I guess it would also be important, like if they still transmit the disease to the adults that are around them, then that potentially could be dangerous. And I guess it's nice to hear that under 10 there's a lower rate of transmission. However, still I guess relevant that children over 10, as you said, still have about the same rate of transmission as adults. Okay, thank you. Yeah, that really is useful information. So we talked about schools opening, like something that is part of daily life for many, and so I was hoping to ask you about, how would you categorize or talk about the infection risk for some of the other, daily activities or routine activities like going to the gym or going to the park or say going to the dentist, right? And or taking a road trip. So can you weigh in on that?
Yeah. So I think that for every person, for every activity that you're considering doing outside of the house, you just have to weigh the personal benefit and your needs with the risks to you or risks to people who are inside your social bubble. There are obviously some things that are riskier than others. We know that transmission occurs at a higher rate indoors than outdoors. So personally, if I can avoid being indoors anywhere, I do. I can work out in my home without other people or outside, which has a lower risk of transmission, so I don't go to the gym right now. The dentist, I think I could go either way. It's still indoors, but preventative medicine is important. If you're just going for a cleaning, maybe you can put it off a couple months, but if you need something more major done, I think it would probably be worth it to see a dentist. They're going to have health precautions in place already, but I'm sure they're taken up another level with face shields and everything, just due to the nature of their work. And I would say outside is, I think, relatively safe depending on the environment. So maybe you're going for a hike and you bring a mask just in case if you're passing people, or if you can stay socially distant, I think that your outcomes are going to be better, and just have a plan for if things get crowded, I guess.
Okay, that's great. And so one thing we have been doing in our household is that when we get groceries, we currently wipe them down, like the bags and stuff. Is it safe to stop doing that, or what's your opinion on it?
Oh, I am probably going to hold off giving direct advice. I can tell you that I personally don't do that, but I can see maybe taking extra precautions like that if you have someone who's immunocompromised in your household that may be more susceptible to getting infections. I wash my hands a lot though, so I mean that's something you can do before and after you get groceries, when you get home, before you sit at your desk, like make sure you're cleaning your phone, all of those things. So there are some things that I will do, but that is not one of them.
Does make sense to weigh the benefits versus overall risk of these different activities and these things that we do. So yeah, great feedback on that. So I guess we talked about a lot of things, and you have provided some great. This has been a great discussion. You provided a lot of really great information and pointed out resources for people to go to. And in this pandemic, a lot of medical and public health professionals have been doing that, right? They're, like you guys are working overtime and really, constantly trying to keep up with the data, keep up with the new information, and at the same time, healthcare workers are, also caring for patients, and you guys are doing testing. So like, there's a lot happening there, and I have heard that a lot of. Partly firsthand, some of my friends and my wife is a physician, and so they have given some feedback and also read about a lot of the medical and public health professionals feeling burned out and frustrated, especially like on topics where they have given advice based on scientific data, and the public, at least part of some people are reluctant to heed that advice, and a lot of this advice is politicized, as we talked about regarding masks or the use of hydroxychloroquine. So I want to ask you, how are you doing?
I'm doing good. This has been really an incredible learning experience. I am thankful that I have the laboratory perspective on this. This is something that in our lifetime, most of my colleagues haven't really seen anything like it. But there's a lot of correlates here, right? So it's like we think about this as like, oh, we haven't seen this since the 1918 flu. There's so many comparisons to that.
Right, yeah.
Another important emerging virus that like severely impacted clinical microlabs was HIV. And that happened within the last few decades. It makes people susceptible to a lot of infections. So I am impressed with the amount of information we've been able to gain as a scientific community in such a short period of time. I do worry about healthcare professionals and hospitals continuing to be overwhelmed because you said many people aren't taking all of the advice that they get. And I guess the one thing that's like my hope and dream about this is just like public health is something that impacts everyone every day, and people don't even realize it because it's like built into our society. So if you think about water treatment and foods that are supplemented with different vitamins or salt with iodine, and like different screening procedures that you go through with your physicians, like there's just so many things that are done in the nature of public health that are preventing risks. But this is just one that we hadn't had before. So people are resistant to implementing these new things. And I just think if we had like a broader discussion about public health and what the outcomes are, and if people were more aware of these things, they may have a little bit more trust in these individuals who really, really know how the outcomes can play out. Because as we see right now in the US, this is something that we need a unified force at. Because if you have half the population or even 75% of the population that are strictly wearing masks and washing their hands and being socially distant, and you have the other 25% not doing that, then it doesn't matter, because there's still going to be uncontrolled spread. There's still going to be asymptomatic usage.
And we're not existing in a vacuum and interacting with each other. So
exactly. Yep.
So that good to know you're doing good. And I guess it's a great point that you brought about public health, because a lot of the major achievements basically are unnoticed, because that's how it is working. It sort of reminds me of what Dr. Fauci was saying in the beginning stage of the pandemic. He said, a few months later, when we look back and say, oh man, did we really need to do these lockdowns? It seems all these measures seem so, so strict. And so if we are able to say that, because, we haven't had really bad outcomes, would be how we can gauge that it was a success. And unfortunately, that hasn't been the case. But let's hope, we have a second chance, and we're, learning from previous mistakes or, things that have been recommended by public health professionals. And
that's so true. It is never too late to start any of these things. They're actually pretty simple. So, yeah. Yeah.
So hopefully, people, more people start listening, and more people follow guidelines, and we get this pandemic under control. So I really appreciate you taking the time today and sharing with us your insights and providing us all this information. So thank you very much.
Thanks for having me.
Really appreciate it.
Yep.